Hello, my name is Haley Robinson, and I'm a third year occupational therapy doctoral student at The Ohio State University. As part of my doctoral capstone, I completed a systematic review on the effectiveness of sensory stimulation to increase arousal in DOC patients. The systematic review is the basis of my capstone experience, where I'm creating a sensory stimulation intervention protocol for my site, which is an inpatient rehab facility. I'm also tracking its results on increasing arousal in disorders of consciousness patients. Today, I'm going to present to you the results of this systematic review. Disorders of consciousness, or DOC, is a state of prolonged altered consciousness. It affects arousal or wakefulness and awareness in a variety of levels along a continuum. The continuum consists of a coma, vegetative state, or unresponsive wakefulness, as it's commonly known now, and minimally conscious state. Occupational therapy is a part of a multidisciplinary rehab program for people with DOC. Interventions for this population, such as sensory stimulation, are based on principles of sensory regulation in which occupational therapists are knowledgeable about. The primary outcome of rehab and OT is to increase arousal while preventing secondary medical complications. Sensory stimulation is an intervention approach aimed at promoting arousal and behavioral responsiveness by the application of environmental stimuli in DOC patients. Sensory stimulation has been a technique that has been researched to help increase the arousal. These programs provide controlled exposure to simple, frequent, and repetitive environmental or sensory-specific stimuli. Sensory stimuli are administered through multiple sensory channels with moderate to high intensity and include visual, auditory, tactile, gustatory, olfactory, and proprioceptive stimulation. They are typically administered unimodal, multimodal, or by family member. The purpose of this review is to analyze the current literature on the effectiveness of sensory stimulation protocols on increasing arousal in adults with DOC. Now I'll talk about the methods of this review. 3 databases were searched for relevant articles using keywords related to disorders of consciousness, TBI, sensory stimulation, arousal. The search was limited to articles written since 2000 and were intervention-based studies of adults with DOC. A total of 373 articles were screened, and after the review process, 18 articles were left to be included in the systematic review. The full review process can be seen on the left figure on the screen. Each article was critically appraised and given a level of evidence score based on the appraisal and assessed for elements of bias after selection into the review. The quality of evidence and the strength of recommendations was evaluated using the grade process. Once the overall quality of evidence and strength of recommendation was determined, each intervention was given a score from the evidence alert traffic light system. Now I'll discuss the results from the review. Out of the 18 articles included in the review, 8 were randomized controlled trials, 3 were quasi-experimental trials, and 7 longitudinal type of studies. The levels of evidence were determined using the Oxford levels of evidence, which can be seen on the left side of the screen. And levels for this study included 2A to 4B. A is a higher quality and B is a lesser quality study. The articles can then be divided into 3 categories based on the type of stimulation intervention: auditory stimulation, family-based stimulation, and multimodal stimulation, which can be seen on the left side of this table on the screen. This table is a grade quality assessment and recommendations, so all of the scores for the studies can be seen here. The included studies provided strong evidence that family-based sensory stimulation can increase arousal, and a moderate level of evidence for auditory and multimodal stimulation to increase arousal. All 3 categories had a weak positive strength of recommendation, and a yellow traffic light rating. The yellow traffic light means that using the intervention with caution due to lower levels of evidence and a lack of consistency between the articles. Individuals with DOC had a greater increase in arousal when auditory stimulation was applied in any fashion, and if the auditory stimulation was personally salient to the patient. There was the greatest increase in arousal. This happened in comparison to using a stimulus that was not as meaningful to the patient, such as a bell ringing. So the implications for practice using sensory stimulation is that it can be used with individuals with DOC to increase arousal, especially when the intervention is individualized. Therapists should create individualized intervention protocols for each patient that are tailored to their preferences for each stimulus. The stimulation should be applied multiple times a day using their own preferences, and either being the personally salient unimodal auditory stimulation or a multimodal stimulation that includes some type of auditory stimuli. An emphasis should also be placed on using family-based stimulation and involving caregivers in the delivery of the stimulation. Further quality research is warranted for sensory stimulation programs with larger sample sizes using recommended standardized assessments and similar protocols. Thank you for your time, and here are my references.